Thank you for joining me today, Professor Lowenstein. Firstly, what are the main findings or takeaway points from your presentation on surgery at EURETINA this year?
So the main novelties in surgery now have to do with heads-up 3D display in surgical theater. We now have some systems, including the one that I'm working on, that enable us to operate with a head-wearable device that shows us a 3D image of the surgical field.
Wow.
Yeah, it's very exciting. So it's something that is very important for the surgeon ergonomics, for better illumination, for reducing phototoxicity, and for teaching purposes. My specific system is a novel surgeon-centered surgical visualization and information system that consists of a head-wearable display, 2 ultra-resolution cameras, and an option for multiple software applications.
It sounds really interesting. And what are the next steps for this research?
So the next steps would be to establish more applications that can be used intraoperatively. For example, if we can have on our display the intraoperative OCT and know exactly what we are doing and see it on our head-wearable device, that can be very helpful during surgery. So I think the main developments that we are waiting for is to incorporate the multiple applications that we can incorporate almost like in a cellular phone.
I see. It sounds really good. So what would you say you're most excited about in this field?
The thing that excites me most is the ability to have better visualization, to be able to teach in a very effective manner, and to use some features of the technology that can be very helpful in surgery. For the future, we are envisioning also parts of the technology that will alert us when we get close to the retina and things like that.
Oh, wow, that sounds great. And moving on, because I know you're doing 2 presentations at EURETINA this year, moving on to the second one, could you brief me on what the main takeaway points from that will be?
Okay, wow. Well, the next presentation is really important nowadays when we talk about the area post-COVID-19, because it talks about improving outcomes in the management of AMD patients with home monitoring. And this is really exciting, the ability to monitor the patients at home. The patient takes the OCT image by himself at home and produces gradable images that are comparable to commercial OCT images. We found that they have a very good sensitivity and specificity to detect fluid in the retina, which is a very important characteristic, in a very high sensitivity and specificity as compared to commercial OCT.
Oh, wow. And do you think there'll be an increase in use of these home technologies due to COVID-19 and beyond the pandemic?
We get a lot of enthusiasm for the use of the home OCT now with the COVID-19 era, and especially now that we see that it's not something that's going to end very soon. So, so unfortunately, now we think that having a technology like a home OCT that tells the patient exactly when he has just the beginning of fluid in the retina and he needs to come to be retreated on a very timely manner has a great potential to reduce the number of visits that the patient needs to attend in the clinic and make him come only when he really needs treatment.
Yes, that sounds like a really positive step forward. And that brings me to my final question about this particular presentation and field. I mean, you've covered it somewhat, but what are you most excited about?
The thing that excites me most about this technology is the ability of the patient to monitor his own disease, but not only that, it's the ability of us to detect the recurrence and the need for retreatment the minute that it occurs. We don't need to wait for the next month, because if we saw a patient now with the means that we have today, and he doesn't have any activity, we will send him for a month. But maybe he will have a recurrence after 4 days, and we have such examples. So this is one thing. And the second is the ability of our technology to detect fluid in very minute quantities at the level of picoliters. It already detects there is fluid. The patient needs to be followed up closely and then to be treated on a timely manner.
Wow, that sounds really great. And thank you so much for sharing all of this with me. It's been really nice speaking with you today.
Thank you. Thank you very much. Nice to talk to you.
You too. Bye-bye.
Bye-bye.